Welcome back. Keeping your family safe is your #1 priority and is ours as well. That's why we partnered with Texas Children's Hospital to answer your questions specifically about the youngest members of our families. Joining us now is Dr. Stan Spinner, Chief Medical Officer and Vice President of Texas Children's Pediatrics and Texas Children's Urgent Care. Welcome to the show, Dr. Spinner. It's nice to see you, and I understand you have a brand new family member who's just a couple months old, so this hits home for you as well.
Yes, thank you. I'm glad to be here to join you guys. And yes, it certainly has been quite a ride. And with our 2-month-old granddaughter, lots of concerns, absolutely.
A lot of people out there are learning about this virus every single day, as we all are, right? And they want to keep their families safe. So if you have young children in the home, or maybe you're a grandparent and you've been taking care of young children, what's the protocol? Should we be checking for fever and cough multiple times per day?
So in situations where we don't have any, if you don't have any known exposure to a confirmed case, that's not necessary. You know, the goal really is to try to, again, be around as few people as you can. Young children typically tend to have milder illness, at least that's our findings so far, but they can certainly still have the virus and they can still be contagious. There's still a lot unknown. As someone who doesn't have symptoms, are they still contagious? Because we feel that a lot of children may have the virus and not be symptomatic. So really the bottom line is you want to minimize exposures as much as you can. Within a family unit, of course, with a child, you can't isolate the child from the parents necessarily.
Right.
When you're talking about those who have higher risk factors, maybe grandparents or others who may have immunocompromised medical conditions, you do want to take extra care to try to avoid any type of direct contact if possible. I mean, if you're in the same household, that may not be possible, but there are times when family members may actually, one family member may be, moving in with another family member to avoid that type of direct contact exposure during this time.
And Dr. Spinner, let's say a child is showing signs of the virus, like they're running a fever, maybe they're coughing. What are those next steps we should be taking?
So first and foremost, think of this like you may any other time your child may be showing signs of illness. Is your child still, does he or she still look okay? Are they doing okay? Are they eating? Are they drinking? Are they hydrated? Obviously, you can treat fever like you always have with fever-reducing medications. You want to keep your child well hydrated. And if they're doing well with that in mind, actually keeping them at home, keeping them isolated during the time of their illness is quite appropriate. We know that we're not going to be able to test all children or all individuals for COVID-19, nor is there any specific treatments at this point that we can do. But if you have questions, certainly reach out to your physician. At Texas Children's Pediatrics, we have 51 practices here in the greater Houston area. We also have practices in Austin and College Station. So we can continue to provide the medical care we always have for our patients. Nowadays, we can actually provide a lot of that care through telemedicine, video visiting, or through telephone encounters, so that we don't have to necessarily bring the child or the family into the practice, because our goal is to keep our families safe, our staff safe, and still provide the best care we can in this new virtual world that we're creating.
Yeah, to minimize that human contact. And let's say if you have a sick child, if you want to get Texas Children's Pediatrics on the line, what is the best way to book an appointment if you do want to have that virtual chat with a doctor, or potentially see if your child needs to actually come in and see a provider face-to-face?
Right. So, what you should do is, if you're a patient of ours at Texas Children's Pediatrics, you should call your PCP or your primary care's office like you always have. Now, we have had MyChart availability for scheduling appointments, but with this current situation, we really have not been able to continue that for this a temporary period of time, because we need to be able to screen the calls, see what's going on with the child, to determine, is this a child that's appropriate to bring into the office, or is it one that we would first handle through a telephone encounter with one of our providers, and then determine where to go from there.
We've got about a minute left. I do want to ask you a couple questions that came from our viewers on Facebook. Heather
Sure.
writes in, my daycare is still open. Is it safe for my child to go?
Well, again, the more people your child's around, the more potential risk of exposure. With the current city and county stay-at-home orders, I would say my personal choice would be to not have your child go to daycare. If you have anyone who could potentially take care of your child as an alternative, again, you really want to minimize risk of exposure.
And this next question, I think a lot of people fall into this boat. We mentioned not just parents, but caregivers of young people, and that oftentimes includes grandparents. Ken from Facebook writes, I'm 58 years old. Is it safe for me to be around my 1-year-old grandson?
Well, it's a good question. I'd say, if both are staying home and are really away from other contacts, then I'd say that's a reasonably safe situation. Now, certainly if either starts to develop symptoms, fever, coughing, shortness of breath, those are really the primary symptoms that we see, then it would be helpful to try to avoid contact with the other. But in normal circumstances within that household, if they're together and again, really remaining relatively, isolated from the outside world, then I think that's a reasonable thing to do.
And Dr. Spinner, final thoughts. I know Texas Children's Pediatrics, it's one of the most trusted names here in Houston, but you guys have really taken a lot of extra precautions to prepare for something as contagious as COVID-19.
Yes, we always are, preparing for various situations. Hurricanes, floods are the most common things, but something like this, which is quite, unique, we do prepare for these things. We are in constant contact with our infectious disease experts at Texas Children's Hospital. We're fortunate we have some of the world's finest experts in infectious disease at Texas Children's. So having their expertise in conjunction with the CDC really allows us to be able to, take all the necessary precautions. Again, minimizing risks by bringing in children when they really need to be brought in, trying to space them out so they're not in waiting rooms together, but really trying to do a lot of this care now remotely so that both our families and our staff is protected, and yet we can still give that care.
Well, Dr. Stan Spinner, thank you so much for your time. I know you have not gotten much sleep over the past few weeks, so rest up and stay well.
Thank you so much. My pleasure. Thank you.
And a reminder that Texas Children's Hospital doctors will join us all week long to answer more of our questions. And in the meantime, you can find more information by visiting texaschildrenscoronavirus.org.